Yes, and so this is certainly a bombshell of a story this morning. The study that linked the MMR vaccine to autism caused shockwaves when it was published back in 1998 in the medical journal Lancet. But by 2004, most of the paper's co-authors had withdrawn their support. Then, last February, Lancet retracted that report, saying the research was, quote, unethical. Last summer, Dr. Wakefield was then barred from practicing medicine in Britain. And Brian Deere is the investigative journalist who really blew the lid off of this story, and he joins us live from London this morning. Brian, good morning.
Good morning.
One of the things I want to ask is what was the motivation then for Dr. Wakefield to falsely link autism to the MMR vaccine in that initial study?
Well, I believe that his motivation was essentially to make money. Initially to make money from litigation. He was retained as an expert in a lawsuit for which we know he was paid $750,000 US. But he also had all kinds of business interests which he thought would make considerably more money through promoting the scare and promoting public anxiety over the MMR vaccine.
Then the question seems to be, why would there be all of these other co-authors, and why would it make its way into a prestigious medical journal like Lancet and really shape the discussion and the fears about autism linked to vaccines?
Well, that's one of the great weaknesses of medicine and medical publishing, is that people can publish things that are false. People talk about peer review and such like, and they imagine that there's some kind of safety system. But in fact, the whole system works on trust. His co-authors didn't even know which child was which in the study that he published. And so it is actually possible for a determined cheat to get away with the kind of behaviour that Dr. Wakefield has been involved in.
Well, Dr. Wakefield's still continuing to stand by his study and his findings. Anderson Cooper actually talked to him last night. He went after you. He accused you of being part of a conspiracy to discredit him. Let's just listen to a bit of what he said. Also, he claimed that you were getting paid to do this investigation. Let's listen.
I have read his multiple allegations on many occasions. He is a hitman. He's been brought in to take me down because they are very, very concerned about the adverse reactions to vaccines that are occurring in children. Who brought this man in? Who is paying this man? I don't know.
Did you have a financial interest in doing this investigation, Brian?
I've been an investigative journalist working for the Sunday Times of London since the early 1980s. The point you have to remember about this whole issue is, firstly, that it's not me saying this, it's the editors of the BMJ, a very prestigious international medical journal, who very extensively peer-reviewed and individually checked the facts which were put forward in our investigation this week. So it's not me saying it, it's the editors of that journal who are behind this. But secondly, this material has been published in the United Kingdom in extraordinary detail. If it is true that Andrew Wakefield is not guilty as charged, he has the remedy of bringing a libel action against myself, against the Sunday Times of London, against the British Medical Journal, right, against the television network here, and he would be the richest man in America.
Well, he's alleging that you were being paid to do this article. I mean, you were paid, right, because you were a journalist?
I was commissioned by the British Medical Journal to write the piece, yes.
What about
that's what journalists do.
What about the Sunday Times of London and Channel 4 in Britain?
Yeah, I work for them. Of course, they pay me. I'm a journalist. I was hired to do a job, like you are.
Right. And
you're being paid to do your job, and I'm being paid to do my job.
Yeah,
no more and less to it than that.
You know, the bottom line, though, he's questioning your motivations for going after them. So just to clear this up, what were the motivations for going after Dr. Wakefield in his study?
It was simply a routine journalistic assignment given to me years ago in late 2003, a simple journalistic assignment which I expected would last about a week or 2 weeks, and it just completely opened up when Dr. Wakefield began what we now established has been a campaign of lies. And when you're a journalist and you see that somebody you're dealing with is lying to you, then you pursue it. He then sued me. He was then required to pay my costs, so I received a cheque on his behalf for the previous false lawsuit that he began. And now what he's trying to do is to cloud the picture by, in the same way as he used to cloud the picture by saying some doctors say vaccines are safe, some doctors say that it isn't safe. Now what he's trying to do is to say, well, some people say that he's a liar and he says that I'm a liar. So what he's trying to basically do is to split the difference, and on that basis he can work out a nice little living which he's got going, which has seen him in Jamaica this weekend have an absolutely marvellous time at the expense of the parents of autistic children.
Well, I want to ask you about that. What has been the impact of this study on calling into question the safety worldwide of certain vaccines?
Oh, it's been absolutely devastating because he and a little clique of lawyers and activists around, anti-vaccine activists around him, have been able to spread anxiety, to export it from the United Kingdom, bring it across the Atlantic to the United States, with the result that we're now seeing parents anxious about vaccination. We've just seen the worst outbreak of whooping cough in California since the early 1950s.
Are we going to understand autism and what causes it, though? Because we have seen this rise, 57% from 2002 to 2006 in children identified with autism spectrum disorder. I mean, why is it increasing like this?
Well, I'm a journalist, I'm not a doctor, and I don't give medical advice, but I can say from what I understand, talking to doctors and scientists, is that the cluster of conditions which are called autisms, neurological problems in children, are very complex issues, and science just doesn't have the answer. So when a charlatan like Wakefield comes along and seems to give a very simple answer that blames other people, blames drug companies, now blames me, it's all my fault, parents, a very small number of parents become misled by that and cling to this, because their choice is basically blame somebody else or suffer the possibility that they're left with the guilt of thinking that, that it was their fault that they vaccinated their child. So this is a very vulnerable group that Dr. Wakefield preys on.
Well, your reporting certainly is getting attention this morning. All of it is going to be out there along with the editorial as well. We look forward to seeing all of this. Brian Deere, thanks for joining us this morning.
Thank you.